This segment is sponsored by GBMC Healthcare.
All right, cancer is the second leading cause of death in Maryland, and October is Breast Cancer Awareness Month. Joining us to talk about breast cancer and who should be screened is board-certified physician Dr. Sara. She is the director of Sandra and Malcom Berman Comprehensive Breast Care Center at GBMC and specializes in breast disease. How are you today, doctor?
I'm great. How are you? Thanks for having me.
All right, so tell me now, what are breast cancer screening recommendations that you have for us?
So screening recommendations are for women starting at the age of 40, should be getting their mammograms annually. There's a lot of different data and some controversy over screening recommendations, but as a member of the American College of Surgeons and American Society of Breast Surgeons, we do recommend starting at 40 annually. 3D mammogram is really becoming more of the mainstay of screening. And now we want everybody to start getting back and getting their mammograms after we've had such a long spring with the pandemic and the shutdowns. We are back at full steam ahead with mammogram screening and want to get everybody back in.
Okay. So now what if someone missed their mammogram because of the pandemic? Is it safe to come back to the hospital for my mammogram now?
It is. It definitely is. Okay. We have a lot of obviously measures in place to make it a very safe experience for you. We in my office have the Advanced Radiology Center. Our imaging center is connected to our waiting room. We're having people wait in their cars until their mammogram is ready, so there's not a lot of people congregating in the waiting rooms. Of course, masks are required at all times by all the staff and by all patients. We're cleaning constantly, so my staff in my office and the radiology staff are constantly cleaning all surfaces, door handles, light switches, all the locker rooms, seating. I feel very safe in our office and in the imaging center. I feel better there than the grocery store. So I would absolutely recommend everybody coming in to get their mammograms now.
Okay. Well, I have a lot of family who are breast cancer survivors, my godmother, a few of my aunts. Do you have any advice, or what preventative measures should the rest of, like our family take?
Sure. Depending on, obviously, family history is an important thing to know. And obviously, patients that have had breast cancer should be keeping up with their breast cancer team of doctors and getting their imaging when recommended by that team. A very healthy lifestyle. So weight loss, exercise, eating healthy is all important to help prevent, your risk of breast cancer or decrease that risk. For you, with your family members, getting a formal risk assessment, going to our high-risk clinic, getting evaluated by one of our risk models, understanding what your risk may be and what we can do for further interventions is always important.
Awesome. Thank you so much, Dr. Fogarty.
Sure.
We appreciate it.
Sure. Thanks so much for having me.
All right.